Good morning, good afternoon, good evening, dear colleagues and friends of peace, wherever in the world you might be. As we work towards a world that is free from COVID-19 pandemic, we cannot forget another common objective, a world that is free from conflict and everything it creates. Diseases, displacement, hunger, and even more conflict. Peace has the potential to empower, to unite, and to heal. But the absence of peace has only proven to suppress, to divide, and to injure. Therefore, even as we confront a resurgence of COVID-19 pandemic, there can be no doubting peace cannot wait. The Health and Peace Initiative is WHO's commitment to use health as the most powerful tool to rebuild social cohesion, restore trust within and among communities, and revive livelihood in places where they have been destroyed. By implementing health programs that also deliver peace dividends in conflict-affected areas, the Health and Peace Initiative can contribute to building universal health coverage and stronger governance systems that can protect population from future outbreaks of both disease and conflict. As the Director General has mentioned many times, health and peace are interdependent. We cannot have health without peace. WHO is committed to making peace the contagion that the world truly needs. I thank you.
Well, with that welcome from the Assistant Director General for Emergency Response of the World Health Organization, I would also like to welcome you to this session where we will present the World Health Organization's Health and Peace Initiative. And we get this question quite often. How is health related to peace? How can health contribute to peace? Moreover, in a pandemic, but as you have heard from our Director General, Dr. Tedros, he has been saying it, and he will say it again today in Paris. Everywhere I go, I have the same message: health as a bridge for peace. Health as a bridge for peace, because health and peace are interrelated. And the COVID-19 epidemic has highlighted the centrality of health in all of this. In this presentation, we will illustrate how health can play a role in achieving peace objectives and how COVID-19 can be an opportunity to do so. We will look at the question, is COVID-19 good or bad for peace? And what are the triggers for conflict related to COVID-19? Finally, what can we do about it? That's, of course, where the Health and Peace Initiative comes in. We have all seen the opportunity that COVID-19 has provided when the UN Secretary General called for a ceasefire at the beginning of the outbreak, a call he has since repeated. And several groups have heeded the call in the Philippines, in Cameroon, in Colombia. So COVID-19 can be a good thing indeed. But we are also concerned about COVID-19 being a trigger for conflict, as it works on the dividers, the sources of tension. And with health services stretched, some groups, minorities, disadvantaged groups, migrants or refugees, may be left out, leading to a feeling of exclusion that may actually feed the conflict. Unequal distribution of supplies, like the vaccine, when it becomes available, may lead to a feeling of injustice. And the distribution, we may see riots even to get the vaccine. The lack of information, for example, to people living far away from the center, not having access to correct information may lead to a feeling of exclusion and powerlessness, or leave vulnerable to disinformation. So, but luckily, there are also connectors for peace, and it's important to be aware of them and use them in areas that are prone to conflict. the equitable provision of healthcare, medical supplies can be a powerful capacitator. Mental health interventions have shown to be a very useful tool in reducing tensions in society by helping the often scarred individuals better reintegrate in society. We propose a theory of change. We think we have some ideas on how we can influence the events. And the idea is that if individuals and groups enjoy equitable access to health services and are empowered to cope physically, mentally, with the adversities, that they are more likely to live in harmony, make peaceful contributions to society, and resist violent behavior. So how can we influence these connectors, and how can we influence the capacitators? Now, this is what the Health and Peace Initiative is all about. It helps us to see what we can actually do about it. And the theory of change will guide us to individuals and groups that enjoy equitable access to health services that fulfill their rights to physical and mental health, then health coverage to be more universal, removing there a source of potential tension. And if health actors design health interventions that promote trust and dialogue, grievances can be heard and addressed to generate trust regarding emergency health concerns, leading to a more harmonious society. If communities are empowered to cope with violent conflict, then they are more likely to make meaningful contributions to peace and reconciliation and resist incitements to violence. It does require conflict sensitivity analysis and peace responsive programming, two skills that people involved in setting up programs will need to master. So if health programs can indeed improve citizen-state cohesion through health equity, facilitate cooperation in health governance, promote health and well-being through dialogue and inclusion, they will make a contribution to peace. Now, ask, have we not done this already? And the answer is yes, we have. The equitable access to healthcare is a social cohesion measure, a capacitator for peace. It's part of WHO's universal health coverage goal also. And we see this applied in countries like Ukraine, where we work cross-line, for example, to provide healthcare like tuberculosis treatment that is not available on both sides. This contributes to social cohesion. It helps restore trust. It lessens the feelings of exclusion. Not to forget, it restores health. Health actions linked to peace dividends. So the same is true when we exchange information on numbers of cases of COVID, or for that case, poliomyelitis, on both sides of these dividing lines. Information that all parties have agreed that we will need that information to take the necessary response measures. So there is a win-win for people on both sides. In other areas, in Ethiopia, for example, healthcare centers provide equitable services to all people across ethnic divides. This helps restore trust and remediates the feeling of exclusion. In other countries, South Sudan, but also in Somalia or in Sri Lanka, our mental health programs help ex-combatants coping with the horrors of war they have just witnessed, working on their health and well-being. It also helps them better integrate into a more peaceful society, supporting reparation and reconciliation processes, and contributing to social cohesion. In places like Burkina Faso, we help women to make and sell masks. This improves livelihoods and prevents transmission. But if these women are also related to demobilized combatants, as is the case in Congo, we add an element of making amends to society, creating trust, contributing to peace, effectively interlinking health and peace. And when health clusters engage with trusted community leaders in Nigeria or in Yemen to make sure simple COVID-related messages are adapted to the local situation, it also works to reduce trust increase confidence through transparency, and remove stigma. All peace-building measures that we have in our health programs. And so we have a whole menu of interventions, tools that we can use, so to speak. And they include the equitable access to health services. Remember, universal health coverage is a major goal for the World Health Organization. The mental health and psychosocial support, that is a powerful tool to help people integrate in society. But also the working with demobilization, disarmament, and reintegration programs. More and more health is becoming an important factor in there. Doing cross-line technical cooperation and dialogue, more and more. And health program can become an important factor in mediation and diplomatic engagement. Of course, providing training, building capacity, training on humanitarian principles, on international humanitarian law, on medical ethics. These are all the tools we have at our disposal to ensure that health programs are linked to peace and can deliver peace dividends. So when we respond to the pandemic, it will be important to apply conflict sensitivity analysis and develop peace responsive programs. As failing to do so, we have learned during the Ebola outbreak in West Africa, or later in Eastern Congo, we will have to face the problems that as soon as the COVID vaccine becomes available, how can we now ensure that all countries have equal access to the vaccine? And within countries, all people. So it will become quite an important question that we have to address in the near future. So conflict-sensitive analysis will be important to ensure that vaccines will contribute to peace, not to conflict. So the World Health Peace Initiative aims to achieve all that through a three-pronged approach. Through health, dialogue, and diplomacy, engage with world leaders, promote peace-responsive health policies, and this is exactly what we are doing today at the Paris Peace Forum, and we are thankful for the organizers to have agreed for us to present this. But you will hear the Director General of the World Health Organization addressing the audience and mentioning similar things. We do this through engagement with actors within and beyond the health sector. And when these actors come from various sections of society, such as civil society representatives, business leaders, religious figures, academics, we move forward on that. And this is, again, what we are doing, as we do today, as we have done during the Geneva Peace Week. And you will hear more and more the World Health Organization coming out with this initiative. And through the building of community resilience and health, listening to, understanding, working with and empowering communities, entering in community dialogue, community conflict resolution. In this way, we will ensure that the World Health Organization plays an active role through healthcare programs in achieving peace dividends. And this is what the Health and Peace Initiative is all about. It relates very much to the topic of the Paris Peace Forum, how to ensure that COVID-19 will be an opportunity for sustainable peace, how health programs and health outcomes can produce peace dividends. And in the Health and Peace Initiative document that you can access online, we have listed the whole range of activities that actually will allow us to achieve exactly that. So let's make sure together that COVID-19 crisis is an opportunity indeed, and let's not waste a good opportunity to ensure to make health programs in a conductor for peace activities. Thank you very much for your attention. So we are happy to take questions now. We have a a question on current political atmosphere in Ethiopia at the end of 2020 and tensions between political leaders and candidates. Now, this, of course, goes way beyond health and peace. This is a typical political question that I would defer to our Director General, who happens to be from Ethiopia. But again, when there will be displaced persons, as we see right now in the conflict in Ethiopia, we think it is quite important to ensure that whoever is displaced will also have access to healthcare, and start already from that. It's important for the World Health Organization to provide healthcare, for the Ministry of Health with the World Health Organization, but the provision of equitable healthcare, I think, is important start, and may start the discussion on equity. Let me see. Any more questions coming up in the chat box? Do you intervene in collaboration with the authorities and at the request of the authorities? In general, WHO is a member state organization. And so we always work very closely with the relevant authorities. We work very closely on health programs with the Ministry of Health. Of course, the main objective of the World Health Organization is to ensure everybody achieves the highest level of health that is possible. So that's our main mission for the World Health Organization. And of course, in the programs, we ensure, one of the three sort of main aspects of what the WHO wants to achieve is we want to achieve that people have access to universal health coverage. We want to ensure that people are protected from the effects of emergencies, be that health disease emergencies like the COVID pandemic right now, but that can be also poliomyelitis or Ebola or other diseases, and also to have an effect on another group of people to increase their health and well-being. These are the 3 billion that, 3 groups of 1 billion that the World Health Organization wants to make a difference for right now, as we are doing. Of course, if that can also lead to having peace dividends, we will be all the more happy. Any more questions? Question from vaccines to universal vaccination. That's quite a leap. It will be important to see how we limit the politicization of access to vaccines, especially in conflict zones and towards migrants. That's a very good question, and that's indeed a concern for us at the World Health Organization. And our people that are involved with the vaccines are working very hard towards that, because for the vaccines, including for the COVID vaccine, Dr. Tedros has said it many times, nobody is safe until everyone is safe. And so we have to make sure that in the case of vaccines, that yes, indeed, vaccines will be universally available, also to people that are living in areas that may not be under the direct control of a central government. But usually in our discussions behind the scenes, governments, they realize that a polio epidemic in an area where they do not have direct access may be a threat to the larger group population. And in general, we have found most ministries very amenable to the idea that it is important to vaccinate everyone wherever they are. We cannot come to the end of the poliomyelitis outbreak of the poliomyelitis. We cannot eradicate poliomyelitis unless we have vaccinated everyone everywhere. And again, until everyone is safe, no one is safe. It's quite important for us. Any more questions from the chat zone? How do you work to be accepted locally by local authorities, religious leaders, etc.? The World Health Organization, as you may know, is working in 45 countries, really, where we have offices, and not only in the capital, but in places, Iraq, Yemen. We really go out and discuss with everybody, South Sudan, because we realize it is important that we be accepted at the local level. And also, if we link health to peace, empowering local communities is a very important factor in ensuring that healthcare leads to a harmonious society, leads to people more in tune with what's happening, and at least not having that grievance. So for us, it is important that we get closely with local leaders, with religious leaders, which was at some point a problem for the polio vaccine, for example. Where is it produced? Is it a good vaccine? So we need to have that discussion in order to come up with solutions, and most of the solutions are very local, so we are very much aware of that. How do you deal with connectivity challenges faced by our target populations, especially in COVID now? Well, yes, that is a problem, although one would be surprised to see how connected and interconnected the world has become today. But I think we are in a position where we reach out through all the contacts we have, through the work we also do with the Global Health Cluster, through the work we do with ministries of health, through the work we do with communities, that we reach out to every single community. And in the case of COVID-19, we have done a tremendous effort to translate some of the messages, the key messages, in a number of languages, in local languages, in languages not spoken by many people, to ensure that the message that we transmit is received and understood by people who may not speak English or French or Arabic. So we are very keen on making sure that we use all available means to actually address this issue. Questions?
Yes.
What are your criteria for defining the elections have been held democratically, and how do you measure your success? Now, WHO is not in the business of defining whether elections are democratically or not. But once a government is elected and recognized, we will work with whatever government there is. But we are the World Health Organization, and there's many other organizations within the UN family who deal with that aspect. So this is, if you allow me, this is a question that I will sidestep, because that's not what WHO is all about. So which tools and channels do you use to spread the use of your app? How do you make health staff around the world aware about the presence of our program? First of all, the people who have access to internet, we have our programs on the WHO website, which you can access. The links are in the program of the Paris Peace Forum. And how do we make health staff around the world aware of the presence of your program? Well, we use opportunities like the Paris Peace Forum to make sure that many people know about. But in the system of the World Health Organization, we do have offices in the regions, we do have offices in countries, and we are now embarking, and this is the starting sort of shot for that one, we are embarking on a project that will make sure that the Health and Peace program, the Health and Peace initiative that we have, is getting better known, and we will reach out to everybody who is interested. And we have already a number of countries that are applying that. Somalia, Ethiopia, Ukraine, Cameroon is in the group. So we will expand, we will make sure that here in Geneva, we will have expertise available to help. And so this, we hope, will be the start of a new, I wouldn't say adventure, but at least an initiative that we hope will go far. What are the cultural considerations you incorporate into medical attention in the conflict zones? Do you also support your actions with local knowledge? The answer is yes. We very much rely on local staff, healthcare workers. As you know, most of the healthcare workers are local healthcare workers. Unfortunately, a lot of them have come under attack recently for the crime of providing healthcare to people, something that we dearly deplore, and where we have a program that measures that. But since healthcare needs to be adapted to local needs, it is important for us that local staff are providing that healthcare. Also in humanitarian programs, we see more and more that the healthcare is actually provided by people who speak the local language and are familiar with local customs. So this is more and more the trend as we have seen in the past. All right, if there is no more questions, then we will have to wrap up. I would like to thank everybody who has been listening to this project, and we will be in contact with all of you. Do not hesitate to contact us either. Our details are in the chat box or in the program. And we look forward to working with all of you, because we think Health and Peace Initiative is an exciting, fairly new, because we have been doing this in the past. What is different today is that it's not just about providing healthcare in conflict areas, but it's how can we provide healthcare and in addition provide also peace dividends. If you can help us do that, we will be delighted. If we can help you do that, we will be delighted to also work with you. So that is one of our messages of today. And so we thank you very much for hearing us, and we look forward to be in contact with you in the future and make health an important factor in achieving peace, which is what the Paris Peace Forum is all about. Thank you.